Imagine a man in his late 50s sitting quietly. He has noticed that his energy is not what it used to be. His sleep is lighter. His confidence has changed. Maybe intimacy with his partner has become less spontaneous, or getting up at night to urinate has become part of his routine. He notices these changes, but he tells himself the same thing many men do. I'm getting older. This is probably normal. And sometimes age really does play a role. The body changes as we get older. But here's the question I want you to keep in mind. What if some of the changes you have accepted as unavoidable are actually worth discussing with a doctor? Sometimes, the first person to notice that something has changed is not the man himself. It may be his wife or partner. She may notice that he seems more tired. He avoids intimacy. He becomes frustrated more easily. He wakes several times during the night. Or perhaps he simply does not seem like himself. This is not about blaming men or asking partners to become doctors. It is about paying attention. Many men become uncomfortable talking about sexual, urinary, or other personal symptoms. Embarrassment can make an important conversation feel much harder than it needs to be, but staying silent does not always make the underlying issue disappear. The most important warning sign may not be the symptom you are expecting. Sometimes, seemingly unrelated changes can share common health risk factors involving circulation, metabolism, medications, sleep, stress, or other aspects of health. So, before we talk about what a partner may notice, we need to understand something important: what changes in a man's body after 50, and what should not simply be blamed on age. That shift in perspective can change how you approach your health. Getting older is not a disease. And that is an important place to begin. After 50, your body naturally changes. You may recover more slowly after exercise. Muscle mass can gradually decline if you are not staying active. Sleep may become lighter or more interrupted. Hormone levels can change, and your blood vessels may not function quite as efficiently as they did when you were younger. These changes can be completely normal. But there is an important distinction that every man should understand. Common does not always mean harmless, and normal does not mean untreatable. Think about your body like an older car. An older car can still run beautifully. You can drive it for years. But as the mileage increases, you pay closer attention to the warning lights. A warning light does not automatically mean the engine is failing. It simply tells you that something deserves attention. Your body can work in much the same way. Maybe you begin waking up several times at night. Maybe your energy drops noticeably. Maybe exercise becomes more difficult than it used to be. Maybe your sexual function changes. Or perhaps you start taking a medication and notice a difference afterward. The mistake is not having a change. The mistake is automatically assuming, I'm over 50, so this must be normal. Stress, poor sleep, medications, lack of physical activity, high blood pressure, diabetes, excess weight, and other chronic health conditions can affect several parts of the body at the same time. That is why doctors look at the whole picture rather than one symptom in isolation. And this is also why you should not try to diagnose yourself from a video. A symptom can have several possible causes, and the right answer depends on your health history, medications, examination, and sometimes laboratory testing. So the goal is not to become frightened every time your body changes. The goal is to become more observant. Instead of thinking, something is wrong with me, try asking, what is my body telling me, and should I discuss this with my doctor? That small change in mindset can turn fear into action and embarrassment into prevention. And this brings us to something many men don't realize. The bedroom can sometimes reveal information about what is happening elsewhere in the body. When most men think about erectile function, they think about intimacy. But another part of the story is easy to miss. Sexual function depends on many of the same systems that help keep the rest of your body healthy. Think about your home's plumbing. If the pipes are healthy, water can move where it needs to go. If the pipes become narrowed or damaged, water delivery can become less efficient. Your circulatory system is more complicated than plumbing, but the basic idea is useful. Healthy blood vessels and good circulation are important for normal erectile function. As men get older, blood vessels can become less flexible, and conditions such as high blood pressure, diabetes, smoking, excess weight, and physical inactivity can place additional stress on vascular health. This does not mean that every change in erectile function is a sign of heart disease. It is important not to jump from one symptom to a frightening conclusion. Erectile difficulties can have many possible causes, including stress, anxiety, medication effects, hormonal factors, sleep problems, and other health conditions. But sometimes, a gradual change can be a useful reason to have a health conversation with your doctor. Imagine a 58-year-old man who notices that his erections are becoming less reliable. He has no chest pain, so he assumes his heart must be fine. During a routine appointment, his doctor asks about his blood pressure, blood sugar, cholesterol, smoking history, activity level, medications, and family history. The point is not that his symptom proves he has heart disease. It doesn't. The point is that his symptom gives the doctor another piece of information that may help determine whether his cardiovascular risk deserves attention. That is a healthier way to look at intimate symptoms. Don't panic. Don't self-diagnose. And don't automatically dismiss the change as just age. Instead, treat it as information. A medical evaluation can help separate what may be related to normal aging from what could be influenced by health issues, medication, lifestyle, or stress. So if intimate changes can sometimes provide a reason to look at your general health, what other signs might men be overlooking? Before we get to those signs, there is another factor that quietly affects both physical performance and relationships, and many men underestimate it. Sometimes, the person who notices a change in a man's health first is the person sitting beside him. Not because she is trying to diagnose him, not because she knows something his doctor does not, simply because she knows his usual behavior. She may notice that he has become quieter. Maybe he avoids intimacy that he once enjoyed. Perhaps he seems more tired, sleeps poorly, gets frustrated more easily, or has started avoiding conversations about changes in his body. And sometimes, she may notice something even more subtle. He seems to have lost confidence in himself. Consider a couple in their late 50s. The husband notices that intimacy has changed, but he doesn't want to talk about it. He starts thinking, maybe she isn't attracted to me anymore. His wife, meanwhile, is thinking something completely different. She may be wondering, why doesn't he tell me what's bothering him? Is he stressed? Is he sleeping badly? Is something happening with his health? The same situation can create two completely different stories inside two people's minds. And that is where silence can become a problem. When a man feels embarrassed, he may avoid the conversation. Avoiding it can create anxiety. Anxiety can increase pressure around intimacy. That pressure can make confidence even worse, which encourages more avoidance. It becomes a cycle. Breaking that cycle does not require a dramatic conversation. Sometimes it begins with something as simple as, "I've noticed a change. I think I should talk to my doctor about it." That is not weakness. It is taking responsibility for your health. And partners have a role too. A supportive partner can encourage a man to seek professional advice, but should not try to diagnose or treat him. Every man also has the right to make his own healthcare decisions and discuss private concerns with his doctor. The message is simple. Don't hide a persistent change because you're embarrassed by it. Talk about it. Get appropriate information. Find out what may be causing it. And most importantly, don't assume that because something changed after 50, nothing can be done. But communication is only the first step. There are several common mistakes men make after noticing these changes, and one of them can keep the problem going. Let turn this into something practical, because knowing that a problem exists is only useful if you know what not to do next. The first mistake is assuming everything is simply age. Yes, aging can change your body. But if you notice a persistent change in energy, sexual function, urination, sleep, or exercise tolerance, don't automatically close the conversation with, "I'm getting older." Age may be one factor, but medications, lifestyle, stress, and medical conditions can also contribute. The second mistake is searching for a quick fix. When something feels embarrassing, it's tempting to look online for a pill, supplement, or secret solution that promises fast results. But a product being advertised as natural or powerful does not automatically make it safe or effective. Some supplements can interact with medications, and some products marketed for sexual health may contain undisclosed ingredients. Before taking something new, especially if you already take prescription medication, talk with a qualified healthcare professional. The third mistake is ignoring cardiovascular risk factors. Blood pressure, cholesterol, blood sugar, smoking, physical inactivity, and excess weight may not cause obvious symptoms every day, yet they can gradually affect blood vessel health. That's why regular medical checkups matter, particularly as you get older. The fourth mistake is stopping physical activity. Many men become less active after 50 because they feel they're too old, too busy, or simply not as energetic as before. but regular movement can support cardiovascular fitness, muscle strength, metabolic health, balance, and overall well-being. You don't have to become an athlete. Walking regularly, doing appropriate strength exercises, and reducing long periods of sitting can be meaningful steps. If you have health limitations, ask your healthcare professional what level of activity is appropriate for you. Now, the fifth mistake may be the most important. It is avoiding the doctor because you're embarrassed. A man may be comfortable discussing his blood pressure, but suddenly become uncomfortable when the conversation involves erections, urination, prostate symptoms, hormones, or intimacy. But doctors hear these concerns every day. You don't need to feel ashamed. You don't need to have the perfect words. Simply saying, "I've noticed a change and I'd like to understand what might be causing it," is enough to begin. Remember, seeking medical advice does not mean something serious is definitely wrong. It means you are choosing information over assumptions. And now, let's turn those mistakes into something useful. What signs should actually prompt a man to have a conversation with his doctor? Now that we have talked about the mistakes that can delay care, let's make something very clear. Noticing a symptom does not mean you should immediately assume the worst. Your body can change for many reasons. The important thing is to notice patterns, persistence, and meaningful changes from your normal. For example, an occasional difficult night does not necessarily tell you very much. But if erectile difficulties continue, become more frequent, or represent a clear change from what was normal for you, that is worth discussing with a healthcare professional. The same applies to sexual desire. A gradual change in libido can be influenced by stress, sleep, medications, mood, hormones, relationships, or other health factors. The goal is not to guess which one is responsible. The goal is to find out. Urinary changes deserve attention too. Perhaps you are suddenly having difficulty starting urination. Your stream has become weaker, or you feel that your bladder isn't emptying properly. Maybe you're waking several times each night to urinate and your sleep is suffering. These symptoms can have different causes, including prostate-related problems, medications, bladder conditions, or other issues. They should not automatically be labeled as one particular disease. There are also symptoms you should never simply ignore. Blood in the urine should be medically evaluated, even if there is no pain. Severe or sudden pain deserves prompt attention. And if you are unable to urinate, that requires urgent medical care. Then there are changes outside the urinary or sexual system. A major unexplained drop in energy, a noticeable reduction in your ability to exercise, persistent sleep problems, or new symptoms after starting a medication are all reasons to have a conversation with your healthcare professional. And there is one category where you should not wait and watch. If you experience chest pressure or pain, severe shortness of breath, sudden weakness or numbness, trouble speaking, sudden confusion, or other possible signs of a serious emergency, seek immediate medical attention rather than assuming the symptom is related to aging. The key idea is simple. A symptom is information, not a diagnosis. Don't use a video to decide what disease you have. Use the information to recognize when it may be time to speak with someone qualified to evaluate you. That approach replaces fear with clarity. And once a man recognizes these changes, the next question is obvious. What can he actually do about them? Once you recognize a change, the next step is not to search for one magical solution. There is no single food, vitamin, exercise, or secret bedtime routine that guarantees better intimate health. What matters much more is the collection of everyday habits that support your heart, blood vessels, muscles, metabolism, sleep, and mental well-being. Think of your health like a bank account. One healthy meal will not suddenly transform it, and one unhealthy meal will not destroy it. What matters is what you repeatedly deposit over months and years. One of the most valuable deposits is regular physical activity. You do not have to train like an athlete. Walking regularly can be a practical starting point. Aerobic activity can support cardiovascular fitness, while appropriate strength training can help preserve muscle and physical function as you age. Just as important, try to break up long periods of sitting. Small amounts of movement throughout the day can add up. Then look at your overall eating pattern. Instead of searching for a single superfood, build meals around vegetables, fruits, whole grains, beans, legumes, nuts, seeds, fish, and other nutritious protein sources. Healthy fats can also fit into a balanced eating pattern. The goal is not perfection, it is consistency. Weight is another part of the picture. Carrying excess body fat can be associated with higher risks of metabolic and cardiovascular problems. If weight loss is appropriate for you, even gradual, sustainable changes can be more realistic than extreme diets that are difficult to maintain. If you smoke, quitting is one of the most important changes you can make for your blood vessels and overall health. Smoking affects circulation and increases cardiovascular risk. If quitting feels difficult, do not interpret that as a lack of willpower. Ask a healthcare professional about evidence-based support. Alcohol deserves a similar practical approach. More is not better. How much is appropriate can depend on your health, medications, and individual circumstances, so discuss it with your clinician if you are unsure. And do not overlook sleep. Poor sleep can affect energy, mood, concentration, metabolic health, and sexual well-being. If you are regularly waking exhausted or having persistent sleep problems, it is worth finding out why, rather than simply accepting it as part of aging. Before changing any routine, remember that your medical history matters, especially when conditions or medications are involved. None of these habits promises a perfect result, but together they can create a stronger foundation for healthy aging. And that brings us to something many men overlook. Lifestyle is only part of the story. There is another category that can quietly influence how you feel and function, and it comes in something very ordinary, a prescription bottle. Sometimes the answer is sitting in your medicine cabinet. A man may notice a change in his energy, mood, sexual function, or urination, and immediately assume that his body is simply getting older. But medications can sometimes contribute to these changes, especially when a medication has recently been started, stopped, or adjusted. Certain blood pressure medicines, antidepressants, and other medications may affect sexual function or energy in some people. That does not mean the medication is wrong for you, and it certainly does not mean you should stop taking it. In fact, stopping a prescribed medication on your own can sometimes be dangerous. Instead, bring the concern to the person who prescribed it. Your doctor may be able to determine whether the medication could be contributing, whether another explanation is more likely, or whether a change in treatment should even be considered. Hormones are another area where men can easily jump to conclusions. You may feel tired and think, my testosterone must be low. But tiredness alone does not prove low testosterone. Sexual symptoms alone do not prove it either. Hormonal problems require appropriate medical evaluation, and doctors may consider symptoms, medical history, physical findings, and testing before reaching a conclusion. This matters because several different conditions can produce similar symptoms. So instead of walking into an appointment saying, I know what I have, walk in with better questions. You can ask, could any of my medications be contributing to this? You might ask, should my blood pressure, cholesterol, or blood sugar be checked? You can also ask, is this something that can happen with aging, or should we investigate it further? And if testing may be appropriate, ask, would any tests help us understand what's causing this? Finally, ask the most practical question, what treatment options would be safe for me? These questions can turn an embarrassing conversation into a productive medical discussion. And remember this principle. The goal isn't to find the strongest treatment, it's to find the right explanation first. Once you understand the possible cause, you and your healthcare professional can make a much more informed decision about what comes next. And that principle becomes especially important when we talk about the biggest myths surrounding men's health after 50. Now let's clear up a few myths that can quietly keep men from getting the help they need. The first myth is, erectile problems are always psychological. Stress, anxiety, relationship difficulties, and emotional health can absolutely affect sexual function. But they are not the only possibilities. Blood vessel health, diabetes, medications, hormones, sleep problems, and other physical conditions can also play a role. That is why assuming the cause before getting evaluated can lead you in the wrong direction. The second myth is, if I exercise, everything else will fix itself. Exercise is one of the best foundations for healthy aging. It can support cardiovascular fitness, muscle strength, metabolic health, and overall well-being. But exercise does not replace medical evaluation. If a persistent symptom has appeared, you still need to understand why. The third myth is, if a supplement is natural, it must be safe. Natural does not automatically mean effective, harmless, or appropriate for everyone. Some supplements can interact with medications or create other risks. Be especially cautious with products promising dramatic improvements in sexual performance, testosterone, or energy. The fourth myth is, if my partner is concerned, something must be seriously wrong. Not necessarily. Sometimes a partner notices a change simply because they know you well. Her concern may be a reason to start a conversation, not a reason to panic. Instead of asking, "How bad is this?" ask, "What has changed, and should I have it checked?" And finally, the fifth myth. Talking to a doctor means I'm getting old. Actually, taking preventive care seriously can help you protect your independence and quality of life as you age. Getting older is inevitable. Ignoring your health is not. You don't need to be embarrassed, and you don't need to wait until a problem becomes severe before mentioning it. Now that we've separated myths from reality, let's build a simple plan a man over 50 can actually follow, one based not on miracle promises, but on practical habits that can support healthier aging. Now let's turn everything we've discussed into something you can actually use. Think of the next 30 days not as a challenge to completely transform your life, but as a chance to pay attention, make a few realistic changes, and start better conversations about your health. During the first week, notice. Pay attention to your energy, sleep, physical activity, urinary patterns, sexual changes, and mood. You are not trying to obsess over every detail. You're simply looking for patterns. Maybe you're exhausted every afternoon. Maybe you're waking 4 times a night. Maybe your energy has gradually declined, or you notice a change in your sexual function. Writing these things down can make it easier to explain what has been happening when you speak with your doctor. During the second week, move. Start with what is realistic for your current fitness level. Regular walking is an excellent place to begin. If strength training is medically appropriate for you, basic exercises can help support muscle and physical function. And throughout the day, look for opportunities to sit less and move more. You don't need to do everything at once. Gradual progress is the goal. During the third week, review. Look at the bigger picture. Know the medications and supplements you take. Think about your blood pressure, medical history, weight, smoking, alcohol use, and sleep. If you haven't had appropriate health checks recently, consider discussing them with your healthcare professional. And during the fourth week, communicate. Talk honestly with your doctor about any persistent changes you've noticed. If you have a partner, an open conversation may also reduce unnecessary worry and misunderstanding. The important point is that you don't have to fix your entire life in 30 days. You are simply building awareness and consistency. One better choice today can become a habit tomorrow. And several small improvements, repeated over time, can matter far more than one dramatic change that lasts only a few days. So don't chase perfection. Build a foundation you can maintain. But there is one final idea that may be more important than any single diet, exercise, supplement, or medical test. Remember the couple we talked about earlier? The husband thought his wife was losing interest in him. But her real concern was much simpler. She had noticed that something had changed, and she wanted him to take care of himself. That may be the message many men need to hear. Your partner may not need you to pretend that nothing has changed. She may not expect you to be the same man you were at 30. What she may want is for you to be honest enough to say, "Something feels different, and I'm going to find out why." That is not weakness. You do not prove your masculinity by ignoring symptoms, hiding embarrassment, or refusing help. In many cases, taking action is a much stronger sign of confidence. The husband in our example decides to make an appointment. He reviews his medications with his doctor, talks about the changes he has noticed, and begins making realistic improvements to his activity, sleep, and overall health. That does not mean everything changes overnight. Real health improvements depend on the underlying cause, your existing health conditions, and many other individual factors. But he has done something important. He has stopped guessing and started paying attention, and that can benefit much more than intimate performance. Better health can support confidence, independence, emotional well-being, and quality of life. Honest communication can also reduce the misunderstandings that sometimes develop when one partner is worried and the other is staying silent. Intimacy, after all, is not only about sexual performance, it is also about trust, affection, communication, and feeling comfortable enough to be honest with the person beside you. Your partner can encourage you to seek care, but she cannot diagnose you, and neither can an online video. What you can do is listen to your body, communicate openly, and get appropriate medical advice when something changes. So, if you're a man over 50 watching this right now, here's what I want you to remember.